So far in this unit, we've only discussed simple dominance inheritance. Now we're going to take a look at some different types of inheritance situations that are a little bit unique. In this video, we're going to take a look at sex-linked inheritance. So hopefully by the end of this video, you are getting the hang of solving some genetic problems. In particular, we'll be looking at sex-linked traits. So what is sex-linked inheritance? Well, it's inheritance involving the X chromosome or the Y chromosome in some cases. But for this course, we'll be exclusively looking at the X chromosome. So notation that we have to keep in mind is that two X's means female and an X and Y means male. Remember that the sex chromosomes determine the sex of the individual, and having a Y makes you a male. So if the trait is recessive, a woman must have 2 copies of the gene to have the trait. Meanwhile, the man only needs to have 1 copy of the gene to have the trait. And let's make sure that we look back and why that makes sense. In females, we have 2 X chromosomes. So if you're going to show the recessive trait, both X chromosomes have to have the recessive gene. But in males, there's only 1 X chromosome. So if you have the recessive gene as a male, you automatically have that trait. So if a woman has only 1 copy of the recessive gene, she is said to be a carrier of the trait. Because as a carrier, that female could pass on that condition or that trait to their kids. So here's a look at how we denote the genotypes in sex-linked. This looks very different than what we've seen before, and our Punnett squares will use this notation instead when we are talking about sex-linked genetic problems. So in the case where a normal female has both of the dominant traits, so in this case, the big H and the big H, they're a normal female. If you're a female carrier, you would end up having the little h on one of the X's. In this case, we'd be looking at the sex-linked condition called hemophilia. And hemophilia is a condition that affects the way that blood clots, and you end up bleeding very easily, and it can lead to also complications with bruising. Now, a female with hemophilia will have both X chromosomes with little h. A normal male will have a big H on their X, but a male with hemophilia only needs to have 1 little h on that one X chromosome. So let's take a look at an example. So I would recommend pausing the video right now just to read over the question, and then I will show you how to tackle a question like this. Okay, now that you've read the question, so the question, first off, anytime we do a Punnett square problem, remember we want to identify what the genotype of the parents are. And in this question, we have a female carrier for hemophilia. So that would be X, and the superscript would be big H, but then the other X will have little h. So we can put that in our Punnett square. And then she marries a man that does not have hemophilia. So that genotype would be X with big H and a Y, because he's male. We have a Y, we have an X. So then we can fill our Punnett square. So this first quadrant would be as this. And the second one would be there, and so on. And now we need to predict the phenotypes of the children. This question is not asking for the genotype this time. So what will they look like? Well, we're going to have, now one thing you should notice in a sex-linked one is that we end up with females in right here. So we have 2 X chromosomes, so those 2 quadrants are females, and the bottom 2 quadrants here are males because they have the Y chromosome. And so when we report our phenotypes, we have to consider that. So we should find that out of females, 50% are carriers. In the males, we find that 50% are, or 50% have hemophilia. And 50% of males have or are normal. So you'll notice there that because we only show 2 male genotypes there, that ends up being 50% hemophilia for the males.